Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk about the pediatric SDB form or sleep disorder breathing form. You might have a different copy from mine. I've made my own. By the way, we do give free copies of our form pretty much for anyone that has done anything with us within a certain time limit. So if you've attended one of our webinars, we usually give a 7-day window where you can request handouts or paperwork for free. If you've done a la carte session with us, we will allow you to, within a week, to request handouts for free. If you've done a concierge plan or a VIP plan or a premium plan, we give you handouts during that time for free. So definitely check it out. If you don't have one, we would love to give you a copy. When do you use it? Well, I don't want you putting it in the initial packet that everyone has, if that answers your question, because it needs to come with specific instructions from the doctor, and then it's not something you could just type on the form because there's a why behind it. It's like, well, why are we doing this? If it's a regular class 1 patient with plenty of spaces between their teeth who has normal facial anatomy, normal facial shape, normal facial form, isn't clearly struggling in any ways, then no, they don't need it. I don't see why they would need it. So it should take a parent a couple of days to fill this out. They need to take a couple evenings, come in at different intervals, not always at 10 p.m., not always at 8 p.m. And they need to take 5, 10, 15 minutes to observe their kid each night. Look for signs of mouth breathing, listen to noises that might come out while they're sleeping, even possibly film them would be a great idea. That comes with this form. And if you just give them the form in a downloadable packet or in the office, they're not taking that time to do that. They don't know. So many parents don't. They just put their kids to bed and then goodbye, It's not something they hear or they see or they observe. So that is why we need to actually prescribe this form. So we're looking for patients who exhibit maybe some of the following. Either the parents have had concerns, or you're observing mouth breathing in the office, or you're seeing constricted upper arch, you're seeing crowding, you're seeing a long face, you're seeing a gummy smile, you're seeing an anterior open bite, you might be hearing speech issues. All of these would be red flags to me when reason why I would want to prescribe this form. Obviously, I would tell the parent, hey, we're here to do dental and orthodontic diagnosis here. Sometimes we ask parents to do a sleep disorder breathing form. It's not something that we can do because we don't observe it during the day. It's only observed while your child is sleeping, and it's a lot less invasive for you at mom to come in the room a couple nights and observe for 10 to 15 minutes, film the child if you hear any noises or see anything interesting, than to put a child in a sleep lab, which is just really traumatic and invasive, I think, unless it's absolutely necessary. And this can give us some answers as to some of the orthodontic issues that might be happening. So it's a missing key. So definitely have them fill that out, take their time to fill it out. It can happen after the initial visit, and that's why I don't really actually want you guys making a spot diagnosis, especially for kids right in the office. A lot of you are just like ready, I want to just do a diagnosis now, I want to do a treatment plan now. Well, you don't have all the information. Sometimes we need additional records. Sometimes you just see a concern and then you tell mom, you're going to take a couple of days to get this information. I'm going to take a couple of days to evaluate this information. Then we'll circle back in a week or two and we'll go over the results. Hey mom, is there a good date and time that you're usually available that I can give you a call? Great. Okay, next Tuesday at 4, you will be getting a call from my treatment coordinator or from the doctor if it's an admin day. And we can go over the results that day. Can you put that in your phone? It's just a virtual phone call, virtual phone call. It's a consult, that we're going to do virtually via phone call, or it's a consult virtually we're going to do via Zoom. Or if mom lives by and she wants to stop by during her lunch break, great. Let's schedule you to come in a week or two and we'll just have a quick chit chat. So that's how I want you guys to implement this form. All right. Thanks so much.